Health and Human Services Secretary Robert F. Kennedy Jr. on Thursday released his Make America Healthy Again report. He calls out what it says are the main drivers of chronic childhood disease. The report reads in part, quote, over the past 2 generations, we have failed to address the alarming rise in childhood chronic disease. Federal and state policy have sometimes been guided more by corporate profit than the public interest. President Trump and Secretary Kennedy formally unveiled the report at a White House event Thursday. Kennedy describes it as a collaborative effort across federal agencies.
This is the beginning of a conversation, a national conversation that we are going to have with maturity, with nuance for the first time in history, thanks to your leadership, President Trump.
CBS News digital reporter Alex Tin joins us now. Alex, what are some of the big takeaways from this report?
Yeah, I mean, one of the biggest maybe surprises is the lack of surprises in this report. For people who have been listening to Health and Human Services Secretary Robert F. Kennedy Jr. for a while now, a lot of the things that the report talks about are essentially just a recitation of the things that he has been saying ever since before he became a long-shot presidential candidate and now the head of the nation's public health agencies. You know, he identifies 4 main causes of what he says are childhood chronic disease epidemics in this country. Number 1 being the over-medicalization of children, too many drugs, too many vaccines. Number 2 being what he says is just a lack of physical activity and too much chronic stress. Number 3 being unhealthy food, mainly driven by ultra-processed foods. And number 4 being a real concern with not only all of those factors, but also what he says are chemical exposures, things like pesticides and food additives. Now, it's important to note that this report is just the first step of a process. The next step, that's coming in August, is what the White House says will be another report, taking the findings from this report and applying them into policy prescriptions that they will hope address these issues.
What does the report say about vaccines?
Yeah, you know, specifically about vaccines, just like with medications, there are a lot of concerns in this report that echo the things we've heard from Kennedy for a long time. Concerns that there are too many vaccines in the childhood immunization schedule and that he says they are not safe, they're not tested enough for safety. But of course, we've heard from experts for a long time, a lot of those claims are misleading. And we've heard for a long time, too, a lot of frustration that Kennedy, in his role as the nation's top public health official, isn't doing enough to address those concerns and is instead undermining the very system he was hired to protect.
Heard from a lot of health officials, though, that say the report does misstate some facts or leaves out information. What are you hearing?
Yeah, that's right. I mean, look, there's so many issues that public health officials have told me they have with this report. Some of them are simple things, you know, facts that were taken out of context. For example, there's a fact in the report that says childhood cancer rates are going up. That's true, but it leaves out the fact that a big reason that's happening is because diagnosis has gotten better and also childhood cancer deaths are going down, not up. But of course, there are some bigger issues with the things that aren't mentioned in this report. Some of the big causes that are well documented of childhood chronic disease, things like reducing smoking, things like reducing sodium intake. Those are major factors that public health officials say need to be worked on. They just weren't mentioned at all in this report.
All right, Alex Tin, thank you.